2, 1, action!
Introduction to the Partnership Board. Hi, I am Pete Moore and I am the co-chairman of the Partnership Board. I work with Harold Barber, the head of social services, chairing the meeting. We have Partnership Board meetings 4 times a year, and in this report I'm going to tell you what we did in 2008. The Partnership Board is made up of people with learning disabilities, family carers, professionals and community leaders. Our job is to oversee what's going on for people with learning difficulties in Norfolk and make sure that Vulcan People happens. Vulcan People was a government report written in 2001 and updated in 2008. The key things Vulcan People said were that people with learning difficulties should have the same rights as everyone else, be included in the communities and have the same opportunities as everyone else. Let us see how the Partnership Board has helped to achieve this in 2008.
Hello, my name's Jim Porter. In 2008, I was the part-time Partnership Board Coordinator and I was also Peter Moore's supporter. I'm going to talk to you about the Open Forum. One of the big things we did in 2008 was to start having open forums before the Partnership Board meetings. These are open sessions that anyone can come to and they can ask us questions. The forums have been really popular and people have said they feel listened to. There were lots of questions in 2008 about individual budgets and being in hospital.
Personalisation. People having more choice and control over their lives. Hi, I'm Alice Jubilee. I'm the Person-Centred Planning Project Officer for Norfolk. 2008 has been a very busy year. We've been working with schools about making sure people's reviews are person-centred, and have made a DVD with children's services about supporting young people as they leave school and become adults. We've been working with the library service to set up information centres in 4 libraries across Norfolk, so anyone can find out more about person-centred planning. There are also 5 network groups across Norfolk that offer advice, support and training. Some people with learning difficulties now have their own personal budget to buy the support they need and choose.
Housing. My name's Carol Andrews and I'm on the Housing Group. The Housing Group had a busy year updating their housing plan. They had a conference and talked to groups to get information. They talked to 185 people for their Ask and Listen research. Lots of people moved to new homes. Suffering Housing Trust helped 18 people to rent homes through the private sector leasing project. And 9 people bought their own homes with their home ownership project. The Housing Group also worked with People First of Norfolk to train 60 people on tenancy rights. 64 people who live in NHS homes started moving into their own homes and became tenants.
Hi, I'm Marcia Derbyshire and I'm Project Manager for Employment. There's lots of exciting news about employment. We got money to develop Project Search at Norfolk and Norwich University Hospital, and we opened Hull Food Planet, a shop and a cafe in Norwich. We trained staff to be able to support people into employment and develop micro-enterprises.
I'm Michael Owen Shaker.
United Response now run the Williams Lee project, providing employment in a factory. We identified some team leaders for the new support into employment team. We are a national pilot site for Getting a Life that supports young people with learning difficulties to get a life like any other, including getting a job.
Food and fitness projects. My name is Carl Jackson and I am the project manager for the Food and Fitness Project. The Food and Fitness Project is funded by the Big Lottery. The project delivers short courses throughout Norfolk to people with learning difficulties, family carers and paid staff. Hundreds of people have now learned how to make healthy food choices and be more active. 6 people with learning difficulties were recruited to work alongside me as co-trainers. The first of 5 locality-based food and fitness action groups was piloted in Norwich. It was run by people with learning difficulties for people with learning difficulties and is funded by the Sports Relief. The food and fitness team planned conferences and events for people with learning difficulties and sports providers in January 2009.
Hi, I'm Bridget.
And I'm Tristan.
We're healthcare coordinators and we've been very busy helping people to get their health books and supporting everyone to understand how to use them.
We've helped doctors and nurses and staff at local surgeries to get to know their patients who have learning difficulties.
And we've encouraged GPs to offer people health checks.
We asked people with learning difficulties how to make health services better for them and worked with the Norfolk and Norwich University Hospital to help make people's stay in hospital easier.
This included making a DVD called Top 10 Tips for Going into Hospital.
Hello, it's Tristan again. Just to let you know that I'm now working at the Norfolk and Norwich University Hospital. My job is to help people with learning difficulties and their carers when they come into hospital. Please do give me a call if you want any support or advice.
Hate crime. I'm Danny Barrett. I work for People First in Norfolk. This year we attended hate crime meetings across the UK. We helped write the Keep Safe booklet for the Home Office and were consulted about the Reporting Disability Hate Crime form. We chose the cover. We held a hate crime conference in 2008. We are looking to develop the People in Partnership pack with Norfolk Police. It is a 30-hour training course for people with learning difficulties. We had police students on placement. Police officers came to speak to advocacy groups. And we visited the police station. Build did an accessible guide to using the courts with victim support.
Locality groups. I'm Ian Winterburn and I'm going to tell you about locality groups. We have set of locality groups in North, South, East, West Norfolk and Norwich. Locality groups are like local partnership boards where people from the local area can get together to talk about issues that affect them. They try to sort them out by setting actions. Everybody has an equal voice. Every locality group have subgroups. Some look at health, housing, employment. Subgroups feed back to the locality groups and they feed back to the partnership board. Each locality group have money from the Learning Disability Development Fund to give the goods for projects.
Get involved groups. Hello, my name is Carol Barber and I'm a member of the Get Involved groups in Norwich. We have now got 3 Get Involved groups in Norfolk. They are run by people with learning difficulties and members take it in turns to chair meetings. A key thing they discussed in 2008 was what people do during the day, evenings and weekends. Local managers went to the groups and asked people to tell them what was good and not good. The groups had great ideas for how to make partnership board meetings more interesting and what we should talk about. They did lots of work on the health services that was put into a report for the Eastern Regional Health Authority.
Family carers. Hello everyone, this is Linda Husson, Carer Involvement Officer. I want to tell you a bit about family carers. Family carers from locality groups met monthly with the Involvement and Empowerment team. They helped recruit staff, delivered training and influenced policies like the Norfolk Carers Strategy. A Mental Capacity Act Information Day for family carers was held in Swaffham. It was good, and people said they wanted more events around Norfolk. Family carers went to national events like Carers UK Conference and attended Eastern Region Carers Forum. They were involved in mutual caring research, where the person with a learning difficulty who is looked after also looks after their carer. This has led to Norfolk taking part in a national project.
Valvum People Now and the Eastern Region Partnership Board. Hi, is Peter. The job of the Eastern Region Partnership Board is to make sure all the partnership board in the Eastern Region do the things that were agreed involving people. Maggie Beak and Carl Bygras went to the Eastern Regional Partnership Board meeting in March 2008 to tell them about what we thought about valuing people. Now, it was agreed that Peter Moore and Tracy Sidesme and Debbie Orley would then represent Norfolk. There was a meeting in September all about health, with quite a lot said about the self-assessment framework in 2009. This will be called the Eastern Region Programme Board.
National Forum for People with Learning Difficulties. Hello, I'm Janet Brandish and I'm the representative for Norfolk on the Eastern Region Forum, and I also represent the Eastern Region Forum on the National Forum. My job is to help get our voices heard in Norfolk by the government. The National Forum has decided to work on 4 priorities over the next 3 years: transport, health, advocacy and community lives. I am on the subgroup for community lives, and we're working on issues like direct payments in real jobs and hate crime.
We hope you have enjoyed reading our report and watching the DVD. If you want to find out more about the partnership board, call Caroline Cable, the partnership board coordinator, on 01603 481125, or email her at caroline.cable@norfolk.gov.uk. And of course, you are always welcome to come along to the open forum before partnership boards meetings. We have got lots of work planned for 2009, so we look forward to hearing from you.